Hey everyone, my name is DrRic Saguil. I am a physician. I was trained in the Philippines. That's where I graduated medical school. Then I went on to a few different residencies. That means training post-medical school. Transitional, I was going to be a surgeon, but I decided not to. Then I went into family practice. That I thought I could make a difference in people's lives, so I attacked it 110%. Primary care. And that's when nobody wanted to do primary care. I don't think anybody wants to do primary care because it's so low paying, but that is okay. I found that it was a little bit lacking. We didn't have psychology that was taught, meaning behavioral medicine. Definitely musculoskeletal medicine was lacking, and nutrition is always lacking. So I went on to a fellowship in primary care sports medicine because it just resonated with me. I consider myself, after 25 years of medical school and training, a mature athlete. And I think there's ways to harness that drive, that motivation from anybody, even if you were not an athlete from before. And that's why I run excursions. That's why I'm in a forest preserve in Illinois. I think there's a couple different ways to help people make changes, lifestyle changes, so that you can actually reverse the diseases that you are being diagnosed with, or at least the symptoms. And if you don't have symptoms, that's fine, but if you're not the perfect BMI, body mass index, or you get winded with one flight of stairs, or you have hot flashes, erectile dysfunction, mood disorder, that is still the beginning of disease. And you don't want to wait for that stuff to percolate. It's important to get to the root cause as soon as possible, as soon as you feel the symptoms, and then start to reverse. And that's where I do think if you get something early enough declared, then tests if necessary to diagnose and hone in a diagnosis, then you come up with a plan. That's not just medicines. Usually it involves the three things that I think are the most important. That would be exercise, movement, nutrition, and then spirituality. Yeah, spirituality is usually a sore thumb with a lot of people because I don't think a lot of people know the value of spirituality. And I'm not here to lecture anybody on religion, but I do think that if we're going to survive long term with strict lifestyle changes, the endurance and durability that you need to maintain a lifestyle change when everybody else doesn't care, everybody else is eating and drinking, everybody's going to sleep at 3 in the morning, and you're there going to sleep at 9:30, waking up early. It's easy to compare yourself to the rest of the population, but sometimes, whether it's a terminal disease like cancer, or a long-term infection, or an autoimmune disease, you have to have durability to maintain that lifestyle change that is given to you once you figure out the basic building blocks. Those three elements are easy to understand, but hard to implement. And that's why I'm in a forest preserve. In Illinois, we have forest preserves, and it gives you an option to get away and disconnect. Now, a lot of my patients will at least start an exercise routine by walking, and I think that's a good start. You don't stop there. In fact, that old rule of 10,000 steps a day was made by a company, I think it was out of Japan, that was trying to sell their product or step counter. Genius, but there's no basis to 10,000 a day. I think in the long run, it's still a suggestion that's very powerful to help you move because you don't need any training, you don't need any special shoes. You can pretty much do it anywhere. You should be able to do it anywhere. And the mind sees that you're moving. If you're in nature, you also get that element of nature therapy, which is your first hint at spiritual practice. That basic building block for keeping you in the game of long-term lifestyle change. If you feel the green and the blue, I should say you see it, but feel it, that's exactly what I think empowers people to begin. And that's my job as a lifestyle coach, is to harness your strengths, identify your weaknesses or deficits, and then move forward. I have a practice that's a hybrid. It's not really concierge. That concept of concierge is usually when a very busy doctor takes a small panel of tried and true patients that have followed him and knows those guys, hopefully, and then he takes them outside of insurance, charges an annual fee in addition to collecting insurance, and then that person is their doctor, whether it's going to the hospital, getting a phone call in the middle of the night, getting a second opinion, that concierge doctor goes with. At least I think that's what they do. My only gripe is that most of my friends that do concierge medicine do not have extra training. After family practice, I went on to sports medicine. That's a fellowship, musculoskeletal medicine. And then after that, I began doing acupuncture because, again, I wanted to have a shortcut to get people better. Instead of waiting for orthopedic surgeon or the referral for physical therapy to be approved, I would just throw some needles in and start making people feel pretty decent with my acupuncture. But alas, it's not covered by insurance, so I had to stop it. I mean, it was a great technique to apply to my patients, and I would do it as much as I could. Because most primary care doctors work for organizations, you have to prove your worth, and the only way to prove your worth is to see a lot of patients and a lot of volume, which leads me to why I do things differently, why I don't take insurance. It's because insurance, if you do take it, they reimburse you for the complexity of the visit and the time for the visit that's spent. And you can get rich if you take insurance, but you have to oblige to the rules of insurance, which are usually 15-minute visits. You tell me how a coach is supposed to give you advice in 15 minutes to reverse mood, teach you nutrition, and design an exercise routine, and then look at your numbers, your blood tests, your imaging tests, and see exactly what's going on. Even if you have none of that and you're just in for depression, imagine if I say, okay, 15 minutes is up. That's all we can talk about today. So let's just have you come in next week. That's what insurance companies suggest. Break up the visit. Don't just take care of everything, all 5 problems at once. Take care of 1 problem or 2 problems and have the patient come back. Well, that's convenient for us. It's not convenient for my patients. So I would usually overextend. And I think patients liked that, but the bosses don't, because spending more than 15 minutes usually decreases the amount of patients you can see in one day, and that is not what's called MGMA. It's an organization that determines how many patients should a doctor see. And I don't know how they came up with that information, and that's how they get paid too. So I think it's unfair, and it sets up for really the wrong kind of healthcare. So that's why I run my practice, has no insurance. I don't have to be obliged to a company that is going to try to tell me how to see my patients or how much time to spend, but I have to charge a membership. I'm solo, I don't have anybody to chase after insurance. I also spend about an hour and a half per person, because I think it takes that much time to find out what is going on and what has been going on. Again, identify strengths, identify weaknesses or deficits, and move forward. Young people, doesn't probably take that long, because usually they're so bulletproof with their hormones that they just need a couple of adjustments or some scenarios. If you don't fix this, you'll have this. Most older people, I mean 30 and above, need a lot of time. 70-year-olds need a lot of time to express themselves. 30 to 40-year-olds, they need a lot of time because so many medical problems. I mean, by the time you hit 30, 40, you usually have a taste of high blood pressure, a taste of cholesterol, a little problem with diabetes or prediabetes, and it's just the beginning. That's called metabolic syndrome. That's always reversible with lifestyle change. But your average doc, and tell me if I'm wrong, usually gives you a medicine for blood pressure, a medicine for cholesterol, a medicine for diabetes, and then says, come back in 3 months and we'll check you again. Okay, we checked you, everything's cool, you're back to normal, but you need 3 medicines. That's not lifestyle change. If you look at all the algorithms that doctors follow, they always are preceded by lifestyle change. So don't let anybody fool you. The idea is first lifestyle, and then after that it's medicines and surgeries, procedures. But if your doctor doesn't have the time and you like him, if you like him, that's fine, but you might have to see somebody like me on the side. Come and see me for lifestyle coaching, spirituality development, a nutrition practice to implement, then exercises that would benefit you. Most of all, some form of motivation that'll keep you in the game for the long run. If I give you too much information and we can't act on it, that's not good. It has to be actionable. And sometimes baby steps are important But you don't just stop with the baby steps. Like I was talking about with walking. Great introduction, good work if it's just you and you're trying to figure things out, but always move forward and get to your summit. Just so happens that this is my summit for Carl Hansen. So this is, it's not much of an elevation, but it's okay for Illinois. But you do have, when you're at this vista, it's pretty cool. You do have something to look out to. If I have to travel back all the way down to the parking lot, I have to expend energy. If I don't, I'll be stuck up here. And that's why it's nice to have a mentor that designs stuff and watches you as you progress. If you can progress and you hit the goals and you maintain them, you don't need me or any of the doctors. But it usually does require a lot of work initially. So my suggestion is be your own advocate, have a cool ass goal ahead of you, and not to self-promote, but to ignite the fire for a lot of my patients. I usually take my patients out on excursions to national parks. I've taken people to Arches, Yosemite, Bryce Canyon, Zion, Horseshoe Bend. There's a whole bunch of others I'll be going for later on. But why do I do that? Number one, it's cool. Number two, helps me keep an eye on my folks. Number three, it's something to motivate so that you can move forward. If I just said, I want your cholesterol low in 3 months, as soon as you walk out of the clinic, the depreciation of that advice goes downhill. And every day thereafter goes downhill until you come back in 3 months later, get your blood test, it's still high. Okay, George or Jane, now we got to use medicines. And I think there's ways around that. I like to use herbals. I like to use nutrition. I definitely like to use spiritual practice. I like to hack. So I'll always self-experiment with things that I expect my patients to try. I'll try it first. That's where I think the value of having an integrative medicine doctor is just unsurmountable. So hopefully I can give you your guidance. If you need any help, I'll put the link down below. It's herbal411.squarespace.com. Okay. I'm glad you watched, at least are looking for somebody, looking for me hopefully. If I'm not the person, I can probably get you to a person local to you or give you some building blocks, some steps, some, again, actionable steps to get moving. So, stay healthy. Hopefully this is helpful. If you don't need a doctor right now and you know somebody else that does, please pass this on to them. Otherwise, I do have a YouTube channel. Consider looking at it and subscribing if it helps. I'll see you at the next video.